Hi, I'm Dr. Liz Lipski, Director of Doctoral Studies at Hawthorne University and the author of Digestive Wellness. Today's topic is vitamin D. What most of you may not know is that 57% of us are deficient in vitamin D. In fact, 92% of people of African American descent are vitamin D deficient. So what's the big deal? What does that really mean to us? What that means is that we're more susceptible to cancer, heart disease, diabetes, multiple sclerosis, colds, flu, and a whole slew of other health issues. So let's talk about all that for just a moment. In the 1600s, it was discovered that children who didn't have enough of some essential something started getting soft bones where their legs bowed and their bones didn't develop properly. In the 1800s, during the Industrial Revolution, it was noticed again that a lot of children were starting to have developmental problems structurally. And it was around then that it was discovered that the use of fish oil, especially cod liver oil, was very useful at protecting children. But it wasn't really known exactly what that was all about. But shortly thereafter, in the late 1800s, it was discovered that there was something called vitamin D that you could get from fish oil and also from the sun. And it was used, in fact, in tuberculosis sanatoriums. They'd put people in solariums where they were like little huts where they would rotate them to follow the sun so that people could get sunlight. It was very interesting. And at that point, they realized there was something that we could make in our body from sunlight that would protect our bones and protect our immune systems. The most interesting current research focuses on cancer rates. And what it's found is that the closer people live to the equator, the lower the rates of certain types of cancers, prostate cancer, breast cancer, and others. And we now know that vitamin D is extremely protective against cancers. So some of the most interesting research that we have these days is on vitamin D and cancer, and there's a huge amount of money going into that these days. Also, there's an MD who I interviewed for my Access to Health Experts series named John Cannell, and he's a neurologist and works in a mental institution. And what he did was he realized that many of his patients were vitamin D deficient, so he started giving them vitamin D regularly. Well, one year, everyone in the hospital developed huge amounts of flu. There was an epidemic going through the hospital. And so all the wards got quarantined. And what he found was that in his ward, not one person got cold or flu because they were vitamin D sufficient. Now in that hospital, everybody gets vitamin D all winter long, and their colds and flu have really diminished. Other people have since then taken a look at that and done research to find out that yes, in fact, that vitamin D has antiviral properties as well. Also, research in multiple sclerosis shows that vitamin D deficiency can help trigger multiple sclerosis, and vitamin D sufficiency can help prevent multiple sclerosis and the flare-ups associated with multiple sclerosis. Also really interesting is that heart disease is also protected when our vitamin D levels are adequate and normal. And when we don't have enough vitamin D, blood pressure goes up, risk of heart attacks goes up, and it's very interesting. There have been many studies that show that if you track people's blood pressure levels winter and summer, that they're lower in the summer when there's sunshine available, and they're higher in the winter when most of us don't get enough sunshine. Also, people with kidney disease can't make vitamin D. It just doesn't happen because vitamin D isn't really a vitamin at all. It's a hormone. And what happens is that we get exposed to sunlight, and then that sunlight gets converted in our skin to what we call pre-vitamin D, and then it gets converted in the liver and gets sent to the kidneys where it gets converted into the active form of vitamin D that's actually a hormone. Now, for many of us, we can easily get our vitamin D level checked. And I ask all of my clients to go and get vitamin D levels checked. What you want to ask your doctor to do is a 25 OH vitamin D level. This is the active form of vitamin D that we find in our bodies. And what's known is that to keep your bones and your spine and prevent osteoporosis and to prevent muscular damage, that what you want is a level of at least 32. Many labs are still using the old levels of 17, but 32 is what I consider, and many experts consider, to be minimal. What I'm looking for in my clients is optimal levels of vitamin D. And so I'm looking for levels 45, 50, or even higher, 60, 65, 70. Most of my clients, when I send them to their doctors to get their vitamin D levels checked, what we find is that more than half of my clients are vitamin D deficient, with levels lower than 32. In fact, some of them are in the teens, and I've seen them as low as 12. So as we bring up vitamin D levels, people start feeling better. One thing that I forgot to mention earlier is that vitamin D deficiency has been linked strongly with depression. And so as people's vitamin D levels come up, they feel happier. There's less arthritis. Their blood pressure starts to normalize. They lower their risk for cancer, and so many other great benefits. So please ask your doctor to check your vitamin D level. Now, for most of us, we live north of Atlanta. Anyone who lives north of Atlanta is in what we call a vitamin D winter, in the middle of winter. Because even if you sat out naked at the middle of the day, you'd find that you can't make any vitamin D in the middle of winter. I live in Asheville, North Carolina, and probably for most of February, January, and even into March, there's not the ability to make vitamin D from our skin, which is why it's important to take a multivitamin that has some vitamin D, or to take an extra vitamin D supplement every day. Most vitamins, and the RDA level for vitamin D is 400 units a day. But new research shows that we use 4,000 units a day. So how can we get this 4,000 units a day? Well, on a sunny summer day, it's easy to make vitamin D. If you go out into the sun for even 15, 20, 30 minutes without sunscreen, your body can make 15, 20, or even more thousands of units of vitamin D, which can give you enough that you can store for a rainy day or the middle of winter. You can also find vitamin D supplements. And with many of my clients with low vitamin D levels, I recommend that they take up to 10,000 units a day of vitamin D3. Many MDs use vitamin D2, and they will give people anywhere from 100,000 units once a week to as often as 3 times weekly. Vitamin D2 is called ergocalciferol because it's kind of a fake ergo form of vitamin D. And I prefer to use vitamin D3, which is what we make naturally in our skin and what you find in fish oils like cod liver oil. John Cannell, head of the Vitamin D Research Council, suggests that people take 4,000 units every single day of their life, especially in the winter, just to keep their vitamin D levels normal. What I recommend to my clients is begin with 10,000 units daily of vitamin D3 if your vitamin D levels are less than 32 or less than optimal, and then ask your doctor to recheck your vitamin D levels in 4 to 6 weeks to see if you've brought them up to where you want. At that point, you can just take maybe 1,000 units of vitamin D3 daily to help keep your vitamin D levels up. Another great way to keep your vitamin D levels up is the use of sun lamps during the winter. And what I'll recommend to my clients is to get a vitamin D sun lamp, performing sun lamp, and to just use it while they're sitting watching TV or maybe while you're reading to give your body the extra vitamin D that it can make during the winter. So that's a little bit about vitamin D. At Access to Health Experts, you can find an interview with Dr. John Cannell, and there's so much more that's available. I do hope that you'll do some research on this, and definitely do ask your doctor to check your vitamin D level. Until next time, this has been Liz Lipski, and I hope that you stay well. And remember to take your vitamin D.